By spring, Israel believes most of its citizens will have been vaccinated against COVID, but that doesn't quite tell the whole story. Virtually no Palestinians in the occupied territories have been vaccinated at all, and Israel has no plan to help them anytime soon. Ian Pannell reports.
In the race to inoculate, Israel, population of 9 million, has vaccinated more of its citizens per capita than any other country in the world.
We walked in here 5 minutes ago and we're finished. It's very well organized.
Racing ahead at speeds other countries can only dream of. It's taken them only 3 weeks to inoculate 20% of their population, compared to just 3% in the United States. By the end of March, they plan to have vaccinated every citizen over 16 years old. Some healthcare workers even volunteering their free time to vaccinate others.
We understand that in disaster, in emergency situation, we have a very short time to act. And this is what we really used to do. We are trained to do so. The energy, they want to win the war. They're really looking forward to give the vaccine to as many as possible Israelis.
But the war against this virus isn't won yet. Israel's still being battered by COVID. They've had over 500,000 cases. Just this week, nearly 10,000 new infections were reported in one day alone, a staggering number for a country only about the size of New Jersey.
About 2 weeks ago, we started feeling a rise. We're already on 25, 30 patients daily.
Securing vaccines early has been key to success, but it's also come at a price. In exchange for 10 million doses, Israel controversially agreed to give Pfizer and the WHO the age, gender and other personal but unidentifiable data of those getting the jab, as well as reporting side effects and the efficacy of the vaccine. Its citizens are now part of the largest mass trial of this vaccine in the world. But for all of Israel's success, there's another side to this story. A stark tale of the haves and the have-nots. About 5 million Palestinians in the Israeli-occupied territories of the West Bank and Gaza have been completely left out of Israel's vaccination rollout.
We need the vaccine, and as soon as possible, because we are facing difficult situation in Gaza. We had the lack of resources. We are under siege. So I think Israel is one of the parties is responsible to get the vaccine to Palestinians.
Dr. Mahmoud El-Sheikh Ali is a doctor in the Gaza Strip. Like so many other frontline workers, he's seen what the disease is capable of.
So we don't have mild cases, we don't have moderate cases, we just have patients with high severity, like severe illnesses and critical illnesses. And we have seen too many cases. The hospital was full of patients. We didn't have any empty beds. The capacity was more than 100%, and we had to put some patients in a nearby school.
Palestinians and the WHO say the responsibility is on the Israelis, the occupying force under the Geneva Conventions, to vaccinate. But Israelis say that under the Oslo Accords, the Palestinians are responsible for their own health care. In Gaza, hospitalizations for now have eased, but the fear is that a second wave is just around the corner.
When the general measures in the public will become loose, so they are coming to reopen the schools, markets and mosques. So we think in the coming few weeks, the curve could increase.
Just this week, the Palestinian Authority reached a deal with 4 companies to distribute vaccines in the next 2 months. But there's real anger. Prime Minister Mohammed Shtayyeh accusing Israel of racism over vaccine distribution. Israel's health minister rejecting that, saying its citizens, regardless of creed, come first.
If there would be any shortage on their side, and there will be no shortage on the Israeli side, we would definitely be able to discuss it and cooperate with the Palestinians. But we do have to understand that our first and foremost responsibility is to vaccinate the citizens of the State of Israel.
But in the end, it's two governments fighting the same disease. They'll both need immunity to protect their populations. Both must battle a virus that rages on. Just like Dr. Mahmoud did in Gaza, so Dr. Dalit Seltzer tends to her patients in Tel Aviv. Both sharing the anguish of caring for those who may not make it out.
You have to explain to a patient that he's getting intubated and he might not come back or might not survive. It's very difficult for me, for us, to do that and to explain to the family.
Despite the success of its vaccination program so far, there are still days when it can feel like a losing battle. After a 26-hour shift, Dr. Salzer tells us she just lost another patient.
He was over 90 years old, who stayed at home and received the treatment at home. And he arrived when he was already in a pretty critical state. Despite all my efforts, he passed away in the morning. It's always hard. It's always hard when you lose a patient. I mean, during your career as a doctor, there are those patients you'll remember all your life. You take home with you, you think about them all the time, and when they die, you feel some kind of loss.
Ian Pannell for ABC News Live.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.